How's it going, YouTube? I know it has been about a year since I've made a video, but I wanted to make a video because I got top surgery a whole year ago. But I thought that showing my results would help some people out, so I wanted to talk about who I got it with, how I paid for it, and then what my results were. So I went with Dr. Dulin out of Plano, Texas. Dr. Raphael also is in the same facility that he's in. Dr. Dulin actually trained with Dr. Raphael. So if you've heard of either of them, that's where I went. Dr. Dulin does accept insurance, but I ended up paying out of pocket. I tried to file with my insurance, but they denied it, and I could have continued on to fight them, but it was too big of a hassle, and I actually had the money saved up anyway because I didn't think my insurance would take it. So I did not fight them, and I paid out of pocket. It ended up being $6,750 for the actual surgery. That included the anesthesia and it's an outpatient procedure, so there was no hospital fee. I know some doctors have a hospital fee as well as the anesthesia, but that was all together. His base fee is $6,000, but I ended up needing additional liposuction on the sides. My chest was a little bit larger. This was about a double D, and to ensure that I wouldn't end up with dog ears, they just take a little bit extra fatty tissue out of the sides. Let's see. I ended up staying with my sister, who lives around the area, so that was really nice. I got out of surgery. I woke up. I was actually with my best friend at the time, and he was waking up from surgery too. We woke up. I was a little bit disoriented. My sister drove me back to her apartment. I was hungry, though, on the way back over there. I got some food. I don't actually think I ate it. I think I fell asleep before I ate. I got all set up. I ended up sleeping in her bed. I had like 4 pillows, and then I had one of those pillows that you had when you were little, like a reading pillow. Like really thick at the back, and it has like the 2 sides that come back, so you can kind of like chill like this. What I really wanted, but I didn't know I was gonna want this, was like airplane neck pillows, because it got hard to hold my head up, and it kept like flopping. So definitely I would have enjoyed one of those. So if you're thinking about surgery or you have surgery coming up, get a pillow like that. My sister stayed on top of my medications, so taking my painkillers every 4 hours or however long it was. Whenever I needed to take them, she would come in, make me take them, and I'd fall back asleep. That was like the first day and into the second day as well. Let's see, I went home after 3 days, so I spent 3 days at her apartment, and then I went home. My house is about 3 hours from Dallas, so I went back home. The ride there, I took a muscle relaxer, and I fell asleep. Muscle relaxers really made me sleep, so that was nice. Once I got home, I posted up in my recliner with my roommate, and we each had a side of the couch, and his mom took care of us and made us food, made sure we were taking our meds. But by that 4th day, we were pretty okay. Definitely still in pain. I was mostly taking my painkillers to sleep. Sleeping in the recliner was really uncomfortable. I sleep on my side, I sleep on my stomach, do not sleep on my back. And so having to sleep sitting up was rough, but muscle relaxers helped with that. I had to go back to my surgeon at a week to have the reveal and just make sure everything was healing properly. So we went back to Dallas, had my reveal, everything looked good, and we drove right back to my house. The drive wasn't bad. It was not uncomfortable. There were some bumps that like didn't feel so great, but I was mostly really excited to see my chest. Dr. Dulin doesn't use drains, so I just had a compression vest that he gave me. It felt pretty much like a binder, but I was really thankful for it. It kind of helps with the pain, like having it all like feel like, okay, it's in there, nothing's wrong, like there's still pressure on it. Definitely I had a vest and then also ace wraps around, so I was bound in there pretty tight. Once I got those off, I got to see my nipples that day. They looked pretty gnarly. They definitely look gross when you first see them, but I was super excited. My chest looked really good. Um, this summer, I probably could have spent a little less time in the sun. I started using the scar tape, the Mepitac scar tape, for a little while, but then I stopped using it. I'm not too concerned with how my scars end up looking. I kind of like them. It's like kind of to show where I've been, it's part of me. I know some people are really concerned with making those go away, but that tape did help out, and you can wear it in the water. So I went swimming, had it on. I went out in the sun, had it on. But I guess you probably want to see my actual results. So let me get on that. Okay, so let's see. My scars are pretty purple, so I had a lot of stretching. Let's see. On this side, it's pretty thin. You can't even see it. My scar actually comes all the way over here. But on the side, looks fairly good. Had a lot of stretching in the middle. I'm not really sure why. Maybe I went back to doing normal things a little bit too early. Also could just be how my body heals. So in the middle, I kind of have a little bit of a keloid scar, so it's thicker and a little bit raised right here. I don't know if you can tell. Something on this side goes all the way around. They almost meet in the middle. There's like a little sliver where they don't. I asked for him to not let them touch in the middle. I don't think I would have minded. I thought it was gonna like not look right if they did touch in the middle, but I think it would have been okay. Let's see, on this side, when I put my arm down, there's like that tiny little skin right there. It doesn't really bother me. I think that's what like the lipo was for, to make sure that didn't happen. It might go away in the long run. Now, the only thing that I'm not ecstatic about is my nipples. This one actually looks okay. It's not flat. It's a little raised in the middle there. This one, on the other hand, is pretty flat. It's also pretty oval shaped. They both are a little oval shaped, which I don't mind that much, but I wish this one, the center isn't protruding, I guess. It's flat, which happens. It's just how your body heals, how it takes that nipple graft. Let's see. I can feel all the way all up here is so good that they didn't cut this part. Down here on the actual incision lines, I can feel pressure. I can't necessarily feel. I can feel this. It's a very interesting sensation. So I can feel touching across my chest. I just can't really tell where it is. So if you were to touch my nipple, it's about the same sensation as touching over here. Let's see. I was concerned about losing that feeling, but it doesn't really bother me. Definitely, I think it's still coming back. I think those nerves are still reconnecting, but it's about the same on both sides. There's not really one side I can feel better. I feel weird touching my chest so much in this video, but I'm doing it. I think it looks pretty symmetrical. I'm really happy with that. It feels fantastic. I love being able to just throw on a shirt from the side. Got pec, boom. It feels really natural. There's definitely am not like concave or too flat. It's perfect for my body. Overall, I'm ecstatic. I think it's only gonna get better. I'm only a year post-op, so this is what it looks like. Let's see. With the shirt on, it feels fantastic. I'm not worrying about, like I said, I had double D's, so I'm not worried about, I look completely flat. It is amazing. If you have any questions about top surgery in general, the after process, Dr. Dulin, I can answer all of those questions for you. I'd love to help anybody who's looking into top surgery right now. I'm trying to think if I forgot anything. I was on T at the time of my surgery. I did have to stop 2 weeks in advance he does not require you to be on T to have surgery. I did need a letter from my doctor saying that I had that I was approved for surgery, so I had to get my blood work turned in. But other than that, it was a fairly easy process. He was fantastic. The nurses were so fun. Before our surgery, we were like, last day, like, we were hyped, and the nurses were having a blast with us. They made me feel really comfortable. They used my pronouns. They were totally on board, and they were really excited. They were able to give me the chest that I wanted. Felt really safe. It was a really good experience. So if you have any questions, just let me know.